From the ER to the coroner's office, there are patterns families often miss. When people think about senior deaths, they often assume inevitability: old age, chronic illness, natural decline. But after years in emergency medicine, oncology, and now the coroner's office, I can tell you something important. Some of the most common causes of death in seniors are not sudden and not always unavoidable. They are preventable, or at least reducible, when recognized early. Today, I want to break down 3 of the most preventable causes of death I repeatedly see in older adults. Not to alarm you, but to increase awareness. Because prevention begins long before a hospital admission. The first is falls. Falls are often dismissed as minor accidents, but medically they are rarely just accidents. A fall in a senior adult can trigger a cascade: hip fractures, head injuries, internal bleeding, loss of mobility, hospital-acquired infections, rapid physical decline. What makes falls particularly dangerous is what happens after. Reduced movement leads to muscle loss. Muscle loss leads to further instability. Immobility increases the risk of blood clots and pneumonia. And suddenly, what started as just a fall becomes life-threatening. Most falls are preceded by warning signs: decreased balance, new medications, muscle weakness, vision changes, cluttered home environments. Fall prevention is not dramatic, it is practical. Home safety assessments, medication reviews, strength and balance exercises, adequate lighting, assistive devices when appropriate. Falls are common, but many are not random. The second preventable cause is medication complications. As people age, they are often prescribed multiple medications. Each medication may be appropriate, but combinations can create risk. Blood thinners increase bleeding risk after minor injuries. Sedatives increase fall risk. Certain medications affect blood pressure, causing dizziness. Others interact in ways that strain the heart or kidneys. Polypharmacy, the use of multiple medications, is one of the most underestimated risks in seniors. In the ER, medication interactions frequently contribute to hospital admissions. In the coroner's office, they are often part of the larger story. Regular medication reviews are critical, not just when something goes wrong, but proactively. Ask, does every medication still serve a purpose? Have dosages been reassessed recently? Have new symptoms appeared since starting something new? Medication safety is not passive. It requires active monitoring. The third preventable cause is infection-related decline. In older adults, infections do not always present with classic symptoms. A urinary tract infection may appear as confusion. Pneumonia may begin with subtle fatigue. Sepsis can progress rapidly if early changes are dismissed. The immune system weakens with age. Recovery becomes slower, and small infections can escalate quickly. But here's the key. There are often early indicators: sudden confusion, unusual lethargy, changes in appetite, increased weakness, rapid breathing. Families often describe it as, "they just seemed off." That instinct matters. Early medical evaluation can prevent escalation. Delayed evaluation can allow complications to multiply. Infection does not have to become fatal, but it requires attention. Across these 3 categories, falls, medication complications, and infections, one theme repeats: there is usually progression before crisis. The emergency room is rarely the beginning. It is the escalation point. Prevention starts earlier. It starts at home. It starts with observation. Has strength changed recently? Have medications increased? Has thinking shifted? Has mobility declined? Small changes compound over time. Working in emergency medicine showed me the acute phase. Working in oncology showed me the chronic progression. Working as a coroner revealed the patterns that often went unrecognized. Aging does bring risk, but risk is not the same as inevitability. Awareness changes outcomes. If you are caring for aging parents or planning for your own future, focus on patterns, not isolated events. Falls can be reduced. Medication risks can be reassessed. Infections can be caught earlier. Prevention does not eliminate mortality, but it can delay crisis and preserve quality of life. If this kind of measured medical analysis is helpful, consider subscribing. In the next episode, I will explain why families so often say, "They were fine yesterday," and what that phrase signals medically.